evening, everyone. My name is Christina Nagano, and I live in Coventry, Rhode Island. I was asked by Senator Whitehouse and his staff to come here tonight and share my healthcare story with you. I have had a job and provided myself with healthcare since I was 20 years old. Between my husband and myself, we have always had healthcare for ourselves, and when our son was born, we had it for him as well, at least until recently. In 2006, I was working in a local bank's call center in East Providence. Since the medical insurance was better and cheaper than my husband's employer, I carried the medical insurance for my family. I had been fighting various issues for over 3 years: body aches, extreme fatigue, occasional dizziness, all of which I had seen my doctor for. I had had blood tests run, x-rays taken, all to no avail because nothing showed up. When in February of 2007, I again began experiencing more extreme dizziness, I tried to shake it off, but when I then started losing vision in my left eye, I got scared and went back to my doctor. This time I was sent for an MRI, and the results came back that I had multiple sclerosis. I was 36 years old and scared. I took a medical leave of absence from work to try to get better. Since I was the one who carried the insurance and I was out on medical leave, we had to pay in over $500 a month to continue our coverage. As I was able to collect TDI at the time, that was doable, but TDI only lasts for so long. When my TDI ran out and I wasn't feeling better, we had only one income coming in and finances got tight quickly. Eventually, unable to make the payments, we lost our coverage. I was put in a position to keep a roof over our heads or keep our medical coverage, a place no one should be put in, especially someone with a chronic disease. As the medical coverage at my husband's employer was too expensive for us to purchase on one income, I applied for Right Care. Neither me nor my husband were accepted because we were not pregnant females and did not meet the financial requirements, but at least my son was covered. Unable to work, I applied for total disability and figured that if that went through, we could then afford to get insurance through my husband's employer. Once my application for disability was accepted, however, we lost Right Care because we made too much money. We were then dealt another blow when my husband's employer announced they would be closing. Now my husband was out of work. We reapplied to Right Care and were once again denied, again because our incomes were too high. Let me repeat myself. I'm on disability. My husband is on unemployment, and we make too much money to qualify for Right Care, even just to cover my son. We don't have an employer to go to enroll in medical insurance, and there was no way possible we could afford to insure ourselves. We figured we would pay as we go if anything happened. Thankfully, I've been able to receive my Rebif medication for my multiple sclerosis through Rebif's prescription assistance plan. My medication alone is over $900 a month. Without help, I wouldn't be able to take the medication I need to prevent my disease from progressing. This past February, after taking my medication, I ended up with an infection in my abdomen called cellulitis. After suffering for a number of weeks and 2 appointments to my general practitioner, my husband ended up taking me to the emergency room. There I spent the day. I had an ultrasound. I received IV antibiotics and a prescription to fill at my local pharmacy. All told, it was a $4,000 day that I am now responsible for paying. I have a 7-year-old son at home who has no health care. I was told Right Care had to cover him as he is a child, however, that is apparently not the case. Thankfully, he's been healthy, and I've only had to pay out of pocket for his well visits and a couple of ear infections, during which time Stop and Shop was kind enough to offer free antibiotics. I thank God every night when he goes to bed that nothing happens to him that day that would require medical attention. In addition to the emergency room bill, I'm also paying a $750 bill for another MRI required by my doctor to monitor the progression of my disease, as well as having paid out of pocket for all my doctor's appointments. As of August 1st of this year, I was able to enroll in Medicare, but these bills that have accrued are my responsibility because they occurred before I was eligible. I applied for Medicare mainly because even when my husband gets a job, I have a pre-existing condition, and the insurance company may choose not to cover me, or they may choose not to cover any illness related to my multiple sclerosis. I know I'm not the only one in Rhode Island with this problem. I know I'm not the only one in the country with this problem. Something needs to be done. There is no reason for anyone not to have medical coverage. I don't have the answers to fix this problem. I wish I did. I have suggestions, and I know what I would like to see done. Medical coverage should not be a luxury or even an option. Everyone should be covered, period. Somehow medical coverage should be handed out at birth with your Social Security card. I hope to see healthcare pass for everyone. Healthcare where I can continue to see the doctors that I have seen for years and feel comfortable with. Healthcare that is in my best interest. Healthcare that I can choose for my family and that we are comfortable with and can afford. I know Senator Whitehouse and Senator Reid are taking on this challenge and working on a solution, and I have faith that something will be done quickly. Will you all please join me in welcoming Senator Sheldon Whitehouse and Senator Jeff Reid.
It's supposedly the scariest thing that an ordinary person can do is to stand up and engage in public speaking the way Christine just did. This is about the 50th community dinner that I've done from the campaign forward. This is the 5th community dinner this year. We start every single one with a regular Rhode Islander who is living through a real problem that is an important issue for our country and that helps sort of set the tone for the meeting. And I don't think anybody in all of those meetings has yet done a better job than you did, Christine. So thank you very, very, very much. Well done. We want to move rapidly to your questions and to your comments, but before we do, I'm going to ask Jack Reid, who is my senior senator and who has attended a considerable number of these community dinners, and much appreciate him being here to say a few brief words. I will say a few brief words, and then we're into the evening. Jack, sir.
Thank you, Sheldon. I first want to thank Sheldon for hosting this evening, and he's going to host others. So thank you. I want to make two quick points because we're here to listen, and I think there are so many people that are here to listen to questions and comments, and we hope we can get a good dialogue. First point, the current healthcare system is not sustainable. It's not going to stay the same if we don't do anything. It's going to get worse. Sheldon has a chart over here that shows today the average price for a family for healthcare is $12,000. If we do nothing, by 2016, it'll be $24,000.
That's actually the national number. The Rhode Island number will be $26,000 for a family policy.
That's about, frankly, 45% of the average family's income. And for the United States, we're spending today $2.5 trillion. More than any other country in the world. I suspect we're ranked about 37th when they look at health statistics internationally. That's going to grow to double to $4.4 trillion by 2018. So we have to move forward. The second point I want to make is that the centerpiece of these reforms are insurance reforms. For example, we are going to eliminate the ability of insurance companies to deny coverage for pre-existing conditions. So if Christine is able to get, or her husband is able to get employment insurance, that company can't turn them down because of her condition. Lifetime caps on payments insurance companies make. And I don't know, I've heard a lot of talk about, government bureaucrats, but we get calls all the time in the office from people who have private health care who can't get covered for a procedure. It's a life-saving procedure, they need it, and the companies will say, it's experimental, we don't cover that, or it's just not covered. So we have to do much more. And the heart of this is these reforms. And the other point I think too is with respect to small business. On average, small business pays 18% more than the big companies because they don't have the market power to successfully negotiate. The heart of what we're trying to do is create a transparent market for individuals and for employers if they choose to go in and buy the plan they want. If whatever plan they want that's on the exchange. It's individual choice, and it also is supporting, I hope, the employer-sponsored insurance that we have today. That is basically the standard insurance in this country for years. So those are 2 points that I want to emphasize. Let me conclude my remarks by again thanking you.
Thank you, John.